Good morning. Thanks to Jay and Vicki for interpreting this morning. So, as you may know, on the governor's map, we are back to red. We were in purple for 2 weeks. We're back to red because of some of the trends that both Greg and I are Commissioner Kesterman and I are going to talk about. But it's important to know that we are trending in the right direction. So we'll run through the numbers. Positive cases of COVID-19 in Hamilton County are at 67,772. The increase from last week is 2,624. The total hospitalizations are at 2,438. Increase from last week is 77. And the total deaths in Hamilton County sit at 460. The increase from last week is 5. So for those of you that are paying attention, and I do a week over week analysis of these numbers as we report them out, we are, as Greg has said in the recent past, trending in the right direction on all counts, on positive cases, on hospitalizations, and on deaths. And so that's the great news. The question, I've asked Greg and asked others, what is that attributable to? Why are we seeing trends in the right direction? And I think we've landed on a couple of things. One is people are getting vaccinated. And so people that are most at risk of going into the hospital and dying are the ones getting vaccinated. And so that has been very helpful. The other thing is that, remember, we saw that uptick after the holidays. Well, since the holidays, behaviors have been that people are not getting together. It's cold. People don't want to go out. That's good news because people are either staying at home themselves or at least in their bubbles and not socializing in small groups in other people's homes. And so the spread has gone down. We still have spread in this community, but at least we're trending in the right direction. And so good news to report today. Approximately 65,000 people have started the vaccination process in Hamilton County. So, in other words, they've gotten at least one shot. Some of them have gotten 2 shots. 65,000, that's a lot of people. That represents about 8% of the total population in Hamilton County. Of those 80 years old and above, about 50%, I think it's actually about 52%, have gotten at least one shot. So we are hitting that target for those that are most vulnerable in Hamilton County and trying to get those that are 80 and above vaccinated. So that's also good news. A frequent question I'm getting, I actually got it even from my mom, was after I get that second shot of vaccine, do I need to continue to wear a mask and stay distanced from one another? The answer to the question is yes. Not enough information is currently available to say if or when the CDC will stop recommending that people wear masks and avoid close contacts with those outside their bubble because of the spread, the community spread in our communities. Experts need to understand more about the protection that COVID-19 vaccines provide in real-world conditions before making recommendations and decisions. Other factors, including how many people get vaccinated and how the virus is spreading in communities, will also affect the decision. We also don't know yet whether getting a COVID-19 vaccine will prevent you from spreading the virus to others, even if you don't get sick yourself. So I think, in other words, what the CDC is saying is, first of all, they're going to take a cautious approach to this. So when people get vaccinated, what we know is they have an added layer of protection from getting serious disease. What we don't know is whether or not, if they have the disease in their system, they can spread it to other people. And so that is why they are continuing to suggest that even those that have gotten vaccinated and received those 2 doses wear the mask and stay distant to protect others, not so much the ones that have gotten the vaccine. Hope I'm saying that right, Greg. Greg will correct me if I'm wrong on that. So they're evaluating and will continue to evaluate the efficacy of the vaccine and whether or not that spread is a thing, or whether or not people can not wear the mask and not socially distance once they've been vaccinated. The other thing to know is herd immunity will be very helpful. As more and more people get vaccinated, those restrictions hopefully will go down. I'm going to turn it over to Greg in a second. We also have Commissioner Alicia Reese with us today. She introduced and passed a resolution, passed actually yesterday, related to our response to COVID-19 needs in our community, and a coordinated effort internally from the county to make sure that people understand where the help is coming from and how to access that help. So we'll get to that in a minute. One other thing that I'm going to talk about now, but more to come next week. We just received a memo from the county administrator related to the dollars that fell to the bottom line from the CARES Act dollars last year. If you'll recall, just a tutorial, we got $142 million from the federal government. And we push that money out to small businesses, for rent assistance, to public health, to set up testing programs, contact tracing, housing homeless people. I mean, we did all kinds of things with those dollars. Remember, we had that deadline at the end of the year to spend those dollars. That deadline at the very last moment got extended. And so we've got about $6 million that kind of fell to the bottom line that we now have moving into this year. And so we are trying to figure out collectively where the need is in the community and how those dollars would best be spent. We're getting a report on that next Tuesday. We're going to talk about it at our staff meeting. And so I just wanted to alert folks. We've talked about this a little bit over the past couple of weeks, and I think people are anxious to know what kind of relief will be provided there. So we're going to get to that next week. We will have some graphics to remind us where the dollars were spent last year, and how we are going to build on that or fill gaps with this extra $6 million coming into this year. So more to come on that front. So in the meantime, I'm going to turn it over to Health Commissioner Greg Kesterman to run through the trends and the numbers.
Thank you, Commissioner, and good morning. This has definitely been a week where we continue to see some great trends with many of our metrics, as Commissioner Driehaus just shared. We are seeing less cases, we're seeing less hospitalizations, and probably most importantly, we're continuing to see vaccine clinics in our community. Before I dive in a little deeper on the numbers, I do want to continue to remind everyone that there is a lot of COVID in our community, and if you feel sick, you should definitely get tested. We're very fortunate. I feel like Hamilton County has the best testing program anywhere in the state of Ohio. And so if you need access to testing, visit our website, hcph.org, and find a test site. There's the Test and Protect program has sites throughout the county and is very accessible. Most results are turning around within 1 day, so that's great news. Diving into cases, first of all, our last peak was 3 weeks ago on January 14th. Over the last 3 weeks, the number of cases in Hamilton County has continued to decline at a nice rate. Over the past 7 days, our team on average saw about 354 cases per day. This is down about 100 cases per day from last week during the press conference, and down from our peak, which happened on December 10th. We were at 716 cases per day. So we are happy to be down around 350. That's a great spot to be. We continue want to practice good behavior so we can see these cases continue to decline. I like to point out that while cases are declining, there continues to be a lot of COVID within our community. When you look at those positive cases that we have and those that have presumed recovered, there are about 9,300 individuals that are still carrying COVID within our community. So a lot of need for us to continue to be cautious as we go about our lives, and remember that we must continue to social distance, wash our hands, wear our mask, as well as keep sick at home. Our reproductive number today continues to decline and stay below 1 for the last couple weeks. Today we are at 0.87 for the county, and for the region we are at 0.92. So another good sign that things are starting to constrict a little bit, realizing though that we were on Mount Everest and now we're kind of climbing down, but there's still a lot of work to do here in our community. Hospitalizations are also continuing to decline. The top graph represents Hamilton County, we are seeing about 2 or 3 hospitalizations per day from our county, which also is a nice decline. In addition, when you look at our region, I shared last week, throughout the pandemic, for the last few months, we've been between 750 and 800 cases in our hospitals. This number is much lower today. It's around 550 patients within our region's hospitals. So another great promising sign. Similar things are happening within our intensive care units. We are seeing about a 25% reduction within those locations. So all of these metrics continue to show promise that we're making progress with this pandemic, and they're very hopeful. But I always want to caution that we need to continue to be very careful so we don't continue to see spikes within our community while we wait for more of our population to become vaccinated. Shifting focus over to vaccine, as vaccine continues to come into our community, there is a lot of hope. For those getting vaccinated currently at our clinics, they are very hopeful and thankful, and my team really appreciates the positive feedback. There are many providers in our community that are doing this work. This week we are working on those that are over 70 and above. Next week will include everyone over 65 and above. There remains about 50 providers in Hamilton County, and this week those providers received about 10,000 doses of vaccine. Next week, we are scheduled to begin our schools as well, and so that amount of vaccine will go up for Hamilton County to about 20,500 doses to work on those 65 and above, as well as some of our schools. We're excited for this work to continue. Commissioner Driehaus did just share that we have had nearly 65,000 people vaccinated in Hamilton County, and we are trending about this percentage of total population with the state of Ohio. So I'm proud of all of our providers for the great work that they are doing. In addition, as we continue to get those older individuals or seniors vaccinated, we know that we will have an impact on the number of cases ending up in the hospitals. So this is great news, and this work will continue. Next week, we will continue, as I mentioned, to work with our schools and teachers and cafeteria workers and those that have been working year-round to keep our kids safe and educated. I want to re-emphasize that this will be the first group of individuals that will get vaccine outside of healthcare workers. So these are the first essential workers in our community in the state of Ohio to get vaccine. There are many other essential workers that have been critical for keeping our businesses open and food on our table, and so the governor knows that those individuals need vaccine and is slowly working through a process to figure out prioritization. But I wanted to make sure to emphasize that for our school teachers that are getting vaccine this week, please continue patience as we work to get everyone vaccinated. So in closing, I just really like to continue to emphasize the most important thing is not everyone is vaccinated. We know there's some new strains of COVID within the United States. It's really important. The tools that we have throughout this pandemic are critical. Wear your mask, social distance, and wash your hands. These are the tools that will keep us safe as a community and ensure that we can finish out this pandemic and move on. Thank you.
I'm going to add one layer too. Wash your hands, stay distanced. Oh my gosh. Stay distanced. Wear your mask. Reduce your COVID footprint, which is the fourth thing that we've been talking about. So yeah, this behavior change that we are seeing, I think in January after the holidays has helped create this downward trend. And I don't want to lose sight of that it is to the credit of people in the community that they are reducing their COVID footprint right now. We were also purple on the map, which I think maybe had something to do with it as well. But we need to continue to have that kind of behavior to make sure these downward trends continue as people get vaccinated. So Bridget, we're going to go to questions. Are there questions?
There are. Ann Saker with the Inquirer has questions for you, Greg.
Thank you very much. Thanks so much for doing this once again. Just a couple of questions. First of all, for Greg, I wonder if you could talk a little bit about what you are seeing in terms of possible variant entry into the community. We had a couple of UK variants show up in Kenton County. What are you seeing? What are your concerns? Is this tempering some of the good news that we're seeing with our case rate right now?
So the Ohio Department of Health is monitoring for any variants, and we have not yet found those in Ohio. Although when we see them in northern Kentucky, the likelihood that we find it here at some point is very high. The good news is the tools that we have been promoting throughout this pandemic are going to be successful with the variants, and so the message needs to continue to be the same. It also is another reason to reemphasize, even after you receive your vaccine, while we're still studying and learning these variants and how they behave, it creates additional need for us to wear that mask and social distance so that we're not allowing for illness to enter our lives.
Greg, do you think we've had the vaccine enough in the community and we've vaccinated enough people so that you can attribute some of the decline in the numbers to the penetration of vaccination?
In the general community, I do not think we've made much of an impact. You know, we've seen some younger individuals as well as older individuals in our hospital systems get vaccinated, but general population has not had nearly enough vaccine to make much of a difference. But where we are definitely seeing a difference is within our nursing homes and some of these older congregate settings where there's close quarters and folks have been eligible. We heard Commissioner Driehaus say that nearly half of those individuals that are over 80 have received vaccine. And while that's not quite herd immunity, it certainly is making a big impact on those that end up in the hospital systems.
Okay. All right, thank you. And I had one question either for you or for Denise, whoever wanted to ask about this. Renee Mahaffey Harris at the Center for the Closing the Health Gap told me that she was going to present some data that she and her organization has been collecting with CARES Act dollars to help with a messaging campaign for the vaccine and for other elements of the pandemic. Did you indeed receive that report, and can you tell us what it said?
We did. We received the report yesterday at our commission meeting, and I guess you're not tuning into our commission meetings, so.
Sorry.
So yeah, actually she did a great job. It was an extensive report. She had a lot of visuals to help understand the trends and patterns, and so it was really a great report. In fact, I just asked Bridget Daugherty this morning if that is up on the website, and so the meeting is always up on the website. You can get it there. Bridget, is that identified individually then on the website as well?
It is. So if you go to the agenda for the commission meeting, that extensive report is actually on there, so you can download it off of our Hamilton County website at hamiltoncounty.ohio.gov.
Yeah.
Thank you very much.
Really great information. I think it helped us understand what we think we already knew, which is that people of color are disproportionately impacted, as they often are, in situations related to health and health consequences. And so the idea is to make sure that we are hitting every population in our community and make sure that not only are they getting the vaccine, but they're also getting the testing when they need it. And so it was a very helpful report and reaffirmed really what we thought we already knew.
All right, and one other thing, either Denise or for Greg, and this will be my last question. So we've been watching the racial breakdown of who is getting vaccinated, and especially if you see on the ODH dashboard, so it's barely 5% of African Americans are among those who've been vaccinated so far. Is there a county plan to push harder into the communities, get down to the ground? What do you take from that, and what's the plan to address that?
Yeah, I think actually closing the health gap report yesterday, we're emphasizing this, that we need to make sure that nobody gets left behind, basically in Hamilton County. And so we are tracking those trends. I don't have them in front of me. I can get them for next week. But yeah, we're making a very intentional effort to make sure that folks that have in the past been disproportionately impacted by something but not seen the resources by way of testing and vaccination, that does not play out here related to COVID-19. So thanks for the question. I'll get more information for next week.
Thank you.
Also, we have been joined by Commissioner Alicia Reese. She was detained, but she's here now. So I'm going to ask her to come up and talk about the resolution that passed yesterday. Commissioner.
Thank you, Commissioner Driehaus. We're very excited that yesterday we passed a resolution to form the COVID-19 Economic Relief and Recovery Task Force, because obviously we're working on two tracks. We have the health track, that you just heard about, and certainly that is very important. But what we also heard yesterday in testimony from the Health Gap and so many others is that we also have an economic track that also people are still in need. Unemployment is still too high. People are still, in terms of their businesses, needing help. We want to make sure that the doors stay open, as many small businesses as possible. And so the Economic Recovery and Relief Task Force will be in 2 phases. As we mentioned, phase 1 will be what we call the right now phase, will be if you will, a strike force internally that will be led by different departments put together on how we best repurpose and utilize the COVID-19 dollars, but also how we deal with giving the taxpayers a break. So we're going to be looking at rate paying things. We're going to be looking at ways that, are there ways that we can help reduce your property taxes? Are there ways that we can help with MSD, which is a larger portion of the bill? We're going to be putting all those pieces on the table and then making recommendations back to us as a board on trying to move forward from a policy standpoint. But then also making sure that we have one message. We're looking at right now already putting together a team to have a new portal that will be more of a one-stop for people. They can go right to the portal, be able to be connected directly to those services. We're looking at navigators that would be helpful with people as they apply for unemployment. Of course, we don't control unemployment, but we need a person that can help navigate. So many people have never applied for unemployment before and are now unfortunately having to do that. We're also looking at navigators to help with small businesses, where we could possibly contract out to paralegals that understand and can help small businesses who may not have the resources to have lawyers or big bankers, but can help them navigate so that they can have access to dollars that we have available and dollars that may become available at the federal government. We believe that the task force positions us to build on what has been done, but also to organize us as we are fighting for limited resources. We've got the state budget that the governor has put forward and the legislature will be looking at. There's 87 other counties we have to compete with. We also have a new administration at the federal level, and we want to make sure that they know that we're ready to go and we're fighting to get more resources here in Hamilton County. So I look forward to doing the briefings with my colleague, Commissioner Driehaus, and what she has done to pull together a coalition of stakeholders as it relates to the health side of COVID. And I'm looking forward to having stakeholders on the economic side. So we're hitting, as a board, we're hitting them at both tracks and helping people. Let me just say, since our announcement last week, already we have been able to help people. We've helped folks. Last week I was reading about someone who had sent us letters. I want to let you know that they've been helped. We've been able to help someone, help them with their property tax. We've been able to help someone already to keep their lights on because they just got a new job and the new job won't pay in time for the bill that was due this month. So these are the kinds of things that we're going to be aggressively doing. And I'm looking forward to having more announcements. You'll hear more about the rental assistance that we'll be rolling out and other things rolling out to help our citizens right now. Phase 2 of it will be an external group that we'll be putting together of stakeholders to look at the rebuilding of Hamilton County and how we move forward economically. And we'll be back to you with who would be on those on that board. But right now, we're on the strike force internally to be able to get these dollars, be able to fight for legislation that helps people. So thank you.
Thank you, Commissioner. All right, back to questions.
Next up, we have Corey Sharber from WVXU. He has questions for Greg Anthony's.
Hello, everyone. My first question is for both Greg and Denise. Now, of course, we've discussed, how people should be acting during the holidays, during, of course, Christmas as well as Thanksgiving. Another national holiday is coming up, which is Super Bowl Sunday. What are your suggestions for handling the upcoming holiday?
Thanks for bringing that up. This holiday is no different than any for the last year, and it's unfortunate, but we need to continue to practice those same measures we've been talking about and be creative this Super Bowl holiday. Luckily, most of us watch the Super Bowl on TV, so we can do so safely from home. Maybe set up a Zoom chat so you can have some friends hear you cheering on your favorite team. But at the end of the day, if you're bringing folks that are not within your bubble together, you increase the risks of COVID-19 within our community.
Could you, of course, next week you guys will start vaccinating staff members at Hamilton County schools. Have you guys been facing any challenges with logistics or planning for getting things situated? I know you guys have already have the capacity to accept more vaccines and whatnot, but could you just go over like some of the planning you guys have been doing for this?
At a real high level, the state's plan for vaccinations is to use as many partners as possible. You've heard me say that we have about 50 partners in Hamilton County that are currently providing vaccine. And what this is doing is it's making sure that vaccine is actually out in the neighborhoods of many of our communities. When you go to our website, you can actually see a map of all of the locations of vaccine clinics. And I think this helps bring vaccine closer to the need within our communities. So next week, as we start on schools, there's probably about 18,000 adults that work within schools that are interested in being vaccinated. And the governor's plan is to use many of our partners to make this happen. There are about 12 partners, including public health, that will be tackling this enormous task. So several of our hospital systems have partnered directly with schools. A couple of small flu clinics have partnered with schools, as well as the 4 public health departments in Hamilton County. So lots of logistics, but I'm very confident that we will get the work done as vaccine arrives in Hamilton County next week.
And my last question, yesterday I just so happened to be watching the commission meeting. You did talk about the county's current status, which is red, but it could flip to orange. Now, of course, we're still averaging a lot of cases per 100,000 people, but with the current trends, when could the county dip to the orange level?
The biggest metric that is keeping us at red is the cases per 100,000. That number has to drop below 100, and we are currently just shy of 700. So we need to continue to see those cases fall at the rate that they are. And if that continues in about 3 or 4 weeks, we might be able to get the number of cases drop below a threshold that would allow us to transition back to orange.
Okay, thank you very much.
Thanks, Corey. Next up, we have Molly Lair with WLWT Channel 5, and she has questions for you, Greg.
Good morning.
Good morning. To kind of go off of Corey's questions there and talking about distribution, is there any plan for a mass vaccination site? We've seen it some locally with certain populations like teachers. It seems to be very successful. And we've heard from a lot of people within that 70 and older range who are having real issues coming up with a vaccination time and an appointment. So do you feel it would be better to have a mass vaccination site where you could do large numbers of people within a day?
So one of the partners next week, Kroger, is actually running a large clinics to vaccinate school employees. The issue is when we're trying to think about health equity, if you run a large clinic, you create some inequities in that you are assuming that people have cars and transportation to get to a large clinic, and you're drawing people to one location. So it's not always meeting people where they are and where they need to be vaccinated. Many of our strategies are to bring vaccine clinics out to our community. You've heard me say that we've set up an operation at the Board of Elections so that we can quickly handle large doses of vaccine, but we are also traveling to our communities. Today we are in Miami Township providing vaccine. Next week we're in Evendale. We've been in Forest Park, and we plan to continue to drive to communities and make sure that we're setting up accessible vaccine sites.
And as we expand to 65 and older next week, and also Hamilton County that includes all of these teachers who are eligible next week, is it really just a first come, first serve as far as who's going to get priority for the limited number of vaccines that are available next week? You said around 20,000. There's going to be more people, I'm sure, up for a vaccination at that point.
So the schools are being kind of managed separately, and so by the end of the next week or the following week, we will be done with all of our school employees, and then we'll be able to focus on just those with medical conditions and those that are over 65. I've shared that the best way to get vaccine is to make sure that you're registering and checking with each of the vaccine locations that are within Hamilton County. There are about 12 websites that you can check out and register on, and there's phone numbers if you're not able to use the internet. The one-stop phone number for folks is 211. That will allow somebody who's not good with the internet to have some help navigating the system. Otherwise, if you're not going on each of those websites and registering, you're limiting the access to vaccine that you have.
And last question, we're starting to hear more about the possibility of a need for a third shot, a possible booster. So what do you know about that? When the timing of that would happen and how that's factoring into planning right now?
So at this point, and like at every moment in this pandemic, we really look to the Centers for Disease Control for the most updated science. And while there is some speculation that there may be a need for a booster in the future, there's just not enough science yet known to see if the current vaccines are perfectly effective against any new strains. So at this time, there's no planning happening for a third booster. But I feel confident that if that ever happened, we would be prepared.
Okay, thanks, Molly. Next up, we have Chris Wederick with the Business Courier. He has questions for both you and Greg and Denise.
I'm not really sure. Good morning, Greg. I'm not sure really who this should go to. You guys can decide. But similar to Molly's question, I mean, is there any progress, I guess, on setting up some kind of centralized clearinghouse where you can put your name in, and then when a vaccine is available to you, you'll be called to do it, rather than doing this 12 websites thing? I mean, I keep hearing from people who are eligible now that they just can't get an appointment.
Yeah, so thanks, Chris. Thanks for the question. The lack of availability of appointments is not related to the site. The lack of availability of appointments is related to the number of doses that we're getting from the state. And you heard Dr. Lofgren a couple weeks ago say that is the limiting factor. And so even if we had a huge site set up, we still don't have enough doses to vaccinate people at that site. So that doesn't make any sense. What Greg has said, and it's a philosophical question really for us, is, how are we going to distribute the limited doses that we have? And so we have set up a common site at the Board of Elections in partnership with them. In the case that we get thousands more doses, we're ready to go in a moment's notice in the case that we have that kind of increase in doses. But what you also have heard is that we need to make sure that people have access whether they can get to the Board of Elections or not. And so we're moving out into the community with these smaller sites to make sure that people of color in particular have access to this vaccine, and they don't have to get down to the Board of Elections site. So it's kind of a mixed strategy, but I think it's an appropriate one where the Board of Health and the county commissioners have said this is the approach we're going to use. If we had 50,000 doses for Hamilton County, maybe it would make sense to open up this huge mega site. It's just not where we are. And by the way, some folks have offered, and out of a lot of generosity, this community is so generous. People have offered large sites. If we need them, we know we can access them. Right now, we don't have the doses to justify that.
And I'm sorry, I wasn't really clear on that. When I said site, I meant, I know you guys have a centralized website, but it doesn't have the feature where I just put my name in one place, and then somewhere down the line, when I'm actually eligible and when I get when there's an appointment available somewhere, somebody calls me and I go in. I mean, right now, it seems to me that people are having to call all kinds of different places. It's kind of like a game of whack-a-mole trying to get an appointment, and but people are having some trouble doing that. And I'm wondering if there's any progress on centralizing any of this appointment giving.
Well, so what you're referring to is just the nature of the beast, because the governor has decided that we're going to have wide distribution and many, many partners in each of the counties. And so because of that, each of those entities, the hospital system, public health, pharmacies, have their own way of getting people signed up. If the structure were different, and if public health was getting all the doses, whether it's city public health or county public health, we'd have a common site, and we'd get everybody signed up in the queue, and out we'd go. That is not the way this vaccine is being distributed down into Hamilton County. And so what we have tried to do is create some efficiency around how people get signed up with the either 211 number or the Test and Protect Cincy website. If you go on there, like you said, you're going to see a number of different providers, whether it's Mercy Health or UC Health or Hamilton County Health or whomever it is. And then you as an individual choose which ones you go to get signed up. Greg has said this, I have said this, you probably should go and get signed up at more than one place. If you're affiliated with a hospital system, go to the hospital system and get in the queue. If you want some more options, go to the Kroger site and sign up there. If you live in the city, go to the city health. So people can sign up more than once. We've said before, this isn't perfect, but is the nature of the process that's been set up for us. And so we're trying to make it as efficient as we can, but it is still challenging. Nobody would argue that. We're trying to simplify it as much as we can. And I will tell you this, the 211 number, especially for seniors who sometimes have trouble navigating the web and websites, have found that talking to a real person at the United Way has been really helpful.
Thank you.
Thank you, and that seems to conclude our questions.
Oh, okay. So I wanted to just emphasize some of the things that Greg said earlier. First of all, thanks, Corey, for watching our meetings. So Commissioner Reese and I are grateful for that. Commissioner Dumas. As far as the Super Bowl goes, we had a conversation earlier this morning about this. So as I said, behaviors are driving some of these downward trends. Christmas wasn't great. We had a spike after Christmas. People got together, they ate together, they took their masks off, they were near each other. We saw an increase in cases. We saw an increase in hospitalizations, and we saw an increase in deaths. Let's not make the Super Bowl that same kind of event here in Hamilton County. I mean, there is a way to do this safely. I don't know how many folks in this community are fans of either the Buccaneers or the Chiefs. But if you do get together for this game with people outside the bubble, be careful, wear the mask, stay at a distance. And if you don't do that, right? Get together with people in your bubble or in your immediate family and watch the game together that way, because we really don't want to see a spike as it relates to people getting together for the Super Bowl. And I think we heard Greg say that. So thanks for tuning in. Again, we'll have more related to those CARES Act dollars next week. We appreciate Commissioner Reese being on this morning to expound upon the resolution that was passed yesterday and the collaboration that's going to occur as a result of that. So thanks again.